Now, this is Marjett. He's 15 years old. In February last year, he lost both jawbones and all of his teeth when a tank shell exploded as he was looking for food. He was so severely wounded and the hospital so overcrowded, doctors carried out emergency surgery in the kitchen. Last night, he arrived in the UK to have his face reconstructed. He's only the third seriously injured Palestinian child to be brought here after 20 months of campaigning. John Sparks has been speaking to him and his family. His report contains images of Marjett's facial injuries.
For a boy called Majd, this is quite an adjustment. From the horror of the war in Gaza to an unremarkable view of central London, the 15-year-old tries to take it all in.
What does it look like to you? شو شعورك يعني؟ شو شكله يعني؟ تحب لندن؟ حلوة؟
Equally strange for two of his siblings. There's toys to play with, food to eat, in a place that offers peace and possibly some healing as well.
Would you be comfortable taking your mask off for us?
مثل ما بدك أنت على ريحتك.
Is that okay? Yeah. Thank you.
شكرا.
Can you describe to me what you've left behind in Gaza?
I saw dogs eating human beings and I was terrified. I thought I was going to die. Stuff like that. If we tried to seek shelter, they'd shoot at us.
Marjett and members of his family were greeted with joy and relief at Heathrow Airport. He's a medical evacuee, one of only 3 given permission to travel here from Gaza. The 15-year-old was badly disfigured when he was hit by an Israeli tank shell.
I found a house to look for food, but I couldn't find anything. As I left, the Israelis started to shoot. One friend was martyred, one was shot in the foot, me and another were injured. When I tried to get up, I was hit again.
Marjett lost part of his face and his jawbones and all of his teeth. His injuries were so serious, in fact, the doctors thought he was dead.
When he first got to the hospital, they thought he was dead because the injuries were so bad. But when he raised his arm, they realised he was alive. All the operating rooms were busy, so they carried out the operation in the kitchen. It took 2 hours to close his face.
Marjett will require multiple procedures, but in many ways he's fortunate. His mother was forced to leave 2 of her boys behind in Gaza. These images shot just before the war began.
When I think about how they don't even have a morsel of food to eat, nothing to drink, my soul hurts. I speak to my son and ask him how he is, and he says, "Why didn't you take me with you?"
Very excited.
This evacuation was organised by a group called Project Pure Hope, who needed 20-odd months to persuade the government to support them. Now they want to expand it, and they want financial support as well.
Are you looking for the government to step up financially?
Look, we've done this privately because there was no other option available. But myself and members of my founding team, we've done lots of this work for Ukrainian refugees previously. There's no reason we shouldn't be doing that for Gazans. We paid for that as a UK government and NHS. Why can't we do that? Oh yeah, absolutely. We did that for Ukrainians, and there's no reason we should not be doing that for Gazan children as well.
For some, the brutal nature of this war demands a human response, and this group have found a way to do it. The outcome of their actions may be limited, but they're of undeniable value to this young man. John Sparks, Sky News.
Well, Marjett is one of thousands of critically ill children in Gaza whose only hope rests on evacuations from the region for urgent medical care. Project Pure Hope is a humanitarian initiative which is working to help treat young Gazans wounded in the conflict. With me now in the studio is co-founder of Project Pure Hope, Raza Halim, and also joining me is Baroness Arminke Helic, who has lobbied for Gazan children to be brought to the UK for medical treatment. Thank you both for joining me here on the program. programme. Raza, I'll come to you first because you have been battling this out with the government for months. You managed to get 2 children here. This is now the 3rd. But is it enough?
It's obviously not enough, and the scale of the need is obvious for anyone to see. And we're very grateful that the government has now finally approved the scheme for 30 children. But what we need now is pace and scale, because we know that every day there are 28 children dying from treatable illnesses, and we want to emphasise treatable because it's easy to feel powerless when we see images of death and destruction at this scale. But where the government has this opportunity, and we have this opportunity, to treat these children with world-leading expertise, we should take that up. There's clearly an appetite, not just across the public, but within the NHS with world-leading specialists to provide that treatment. And the UK has a fine tradition of doing so. And now what we need is no further delay.
But for now, and with these 3 children, the NHS is not involved. This is privately funded, and all you're asking is for the UK government to allow more of these children to come.
That's right. Every single one of those evacuations has been arranged logistically, funded privately through the generosity of the Great British public. And what we want the government to do is to follow through on the announcement made on Friday. And the reason that's important is because without it, these children will die waiting. And we have had hundreds of children die waiting. What we've seen through examples from the EU, from America, and other countries in the region, in Egypt, Jordan, elsewhere, is when the government steps in, things move at pace. And that is what's going to save lives in this context.
Yeah, Raza, I just want to put some of these numbers in perspective because we know as of this week, it's been reported that 18,592 children have been killed in this conflict of the 60,000 or so that is now the death toll, the official death toll. And we know when we look at these numbers, you know, regionally, 7,229 patients have been evacuated to places like Egypt, the UAE, Qatar. And of those, 4,984 of them have been children, compared to the UK, where we've seen 3 children.
3. And the point is that the delay is difficult to explain, but it's also deadly. And in this conflict, there's been 5,100 child amputees. And the point about many of those amputations is that they are due to secondary causes, such as starvation and infection. So these are all avoidable deaths. And so that's why these cases are so compelling. There is an opportunity to do something. The pathway has been cleared by Project Pure Hope. Every logistical, practical, medical barrier has been cleared. Approval from COGAT, the Israeli authorities, the Jordanian government. We have surgeons on the ground triaging these cases. If the government wants to move tomorrow, these evacuations can take place immediately.
Let's bring in Baroness Hellich, who's listening in. And Baroness Hellich, you've lobbied Number 10. You've spoken to the Foreign Office. You've been speaking to the previous Foreign Secretary, the current Foreign Secretary. Can you explain what the delay is?
Well, it is very difficult to explain what the delay is. Obviously, in order for any of these to be taken forward, you need political will. If there is a serious decision to help, that help can be immediately put into operation. So I hope that what has recently been declared or has been decided is going to be put into action as soon as possible. But what is needed is political will. What is needed is for the Foreign Secretary and Prime Minister and Home Secretary to all speak from the same sheet and for all of them to want this to happen.
Do you think the political will is there? And you and I have spoken about this in the past when you've been baffled about, you know, how few children have managed to come here through projects like Project Pure Hope that is privately funded. So they're not even asking the state to step in. They are eventually, but the fact is that it hasn't happened. Do you think the political will is there, or are we continuing to see and hear empty statements and rhetoric?
I think that on this occasion, under all the pressures that the government is under at the moment, there is going to be movement forward. Prior to this, I think there have been attempts to do it in the region, in the Gaza Strip, etc. And that was taken, put forward and given to me as an explanation why we ought not to be taking children out of the area that they feel that they're at home, that they feel that they're close to, etc. I think that at the moment, with all the pressures that have been put on the government and everything that we are able to see, what is happening in the Strip, what is happening in West Bank, there are no excuses any longer. However, as I say, it is a matter of political will, and we will see in the days and weeks to come whether that political will is really there.
Yeah, because Raza was also saying his organisation has cleared the way. So if the government wanted to do this tomorrow, they could.
Absolutely, absolutely. I know I have done work with the Project Pure Hope, and I know how much they put in order to really reduce the pressures on the government, whether in the UK, whether those who are in the region, to make this happen. It is a matter of whether there is a serious political will to make it happen.
Raza, do you believe that the government is now in a position with public anger and pressure growing because of the images that we continue to see? And the Prime Minister's statements have been getting stronger and stronger. He said the other day the British public is revolted by the images that they're seeing, that now finally things may move, that we may see more children arrive here in the UK for treatment. I mean you've put the paper in front of them. They have approved it.
I mean, let's be clear. I mean, the British public, healthcare workers in the United Kingdom have made clear what their view is, and the government is now catching up. And yes, the Prime Minister has rightly said that this is appalling, that the conditions are unspeakable, and we agree with him. We agree with the Foreign Secretary that the conditions are an affront to human dignity. But what we need are more than adjectives. We've heard the adjectives. We need action.
And just tell us a little bit more about this scheme. So what you've done with the 3, you want to now expand for 30 more. Are the names approved? You know, are they waiting to more or less move?
Yes, so we have worked with the World Health Organization to approve these children. They can all be triaged. The Israeli authorities have also given approval in principle. These are all cases that are ready to go. And so there is no barrier to any of these children coming. The only barrier that they face is their own demise.
Raza, tell us about some of those 30 children. We saw their Marjett story, what happened to him. He was trying to get food and what happened to his jaw. But some of the other cases, just tell us about their injuries.
Well, just 2 months ago, we featured the cases of Heathrow and Karam. Heathrow had 4th-degree burns. He was a 4-year-old child, all over his body. His eyelids were burned. There was no anaesthetic, not even a sheet of paracetamol to give to this child while he waited. And we tried to persuade the government to evacuate him. And in the time that it took for us to obtain the relevant approvals, the Italian government stepped in and evacuated him, and we assisted with that because speed is the name of the game. And these, again, are illnesses or injuries that all can be avoided. And as I say, the issue with many of these injuries is that they become untreatable over time, or the window of opportunity expires by the time that they get over to the UK, if they ever do. So there are, regrettably and tragically, thousands of these cases. And it's not just that they're missing the opportunity to be treated, it's the pain that they endure while they wait. And that delay, as we say, is unacceptable. And there is a real human cost. We can measure it, the government knows it, and what we say now is that it's go time.
And as you say, many of these illnesses are treatable quite quickly, actually.
Yes, they're treatable quickly. We have, as I said, world-leading expertise and institutions in the United Kingdom to treat them. And many of them are caused by secondary infections because of malnutrition, because of the open sewage in the tents that they live in, or because of the absence of any medicines. So these are very simple steps that could be taken. And it's the difference between limb reconstruction and a half-leg amputation, or the difference between an amputation below the knee and an amputation to the full leg. And so you've got babies who are having amputations before they even learn to crawl. These are all avoidable.
Baroness Helic, just in the last day or so, we've heard the UK government say that if Israel doesn't take concrete steps, that the UK will recognise Palestinian statehood. We've seen a series of other countries, allies of Israel, coming out now saying the same sort of thing. Do you think that that is sufficient in putting pressure on Israel, or are there other things that Israel, that can be done to ensure that aid, for example, reaches the most needy, and we see an end to the famine and starvation that we're seeing currently in Gaza?
I mean, I think the recognition of Palestine should not be based on a threat to Israel to lift siege that has been imposed upon Gaza. That is something completely separate. And I worry that it might not produce the right result, but also that it will be taken against the citizens and the civilians on the ground as a reason for further pain being inflicted upon them. This should have been done a long time ago, but is that going to be producing the right result? I doubt it will, but the time will tell.
Baroness Helic, Raza Halim, thank you both for joining us here on the programme.
Thank you.